How do we look at it? Let's try to understand. But before we go ahead, there is a very important pearl of wisdom, which I always highlight whenever I'm talking about the color Doppler sonography, that grayscale is the most important part of the examination of any vessel. And color Doppler should always be used as an adjunct to it and not as a replacement. What do I mean to say? I mean to say that whenever you're scanning carotid circulation, first have a look at the entire vessel on a grayscale, and then you should use a color Doppler in order to adjunct your findings, in order to add something over your findings. Okay. So this is something which I'm going to be highlighting again and again. We'll be looking at individual cases, but right now, this is the most important pearl of wisdom that I had to give you. Now, let's have a look at this particular cine loop. I don't want you to stress yourself a bit. I just want you to have a look at this cine loop. Now, this is taken from the carotid circulation, and I want you to jot down all the points, all the pathologies that come to your mind. I don't want you to make a diagnosis as of now, but I want you to just think about what is the pathology here. So, for anyone who's ever seen a Doppler, who's ever known anything about Doppler, you would say that there is something gone wrong in this image for sure. I don't know how many of you would be able to pick up it on the grayscale, but on the color Doppler image, you would say, sir, there is flow here, there is flow here, and in the midst, we see that there is very, very less blood flow. I can say just a trickle of blood flow. Why is it happening? Because there is something here in the wall, something here in the wall of the vessel. Okay, this is something which I expect everybody of you to pick it out. If you look at this particular image, probably some of you might have picked up this particular pathology. Now, what is this pathology? Let me just move it here and there. And if you see it carefully, this pathology is also giving some shadowing. So I hope this part is also clear that we are talking about calcium in the vessel wall. And what are we seeing here? In this particular example, we are seeing that the vessel appears occluded, and this appears occluded by some hypoechoic material which is present along its wall, and it is causing luminal occlusion. Now, this is a very rough demarcation of that particular area where some abnormal deposition of a material has taken place in the vessel wall. So this is what a plaque is. It is very simple. I mean, you just have to understand some basic flow dynamics and then everything becomes a cakewalk. So we have, number one, a calcification in the vessel wall. Number two, a hypoechoic. It is a hypoechoic appearing. I think there's no doubt about it. A hypoechoic appearing wall thickening, which is concentric, or you can say concentric but asymmetric. It is extending over a short length of the carotid vessel, and it is causing luminal occlusion because now I can see blood flow through the narrowed lumen only. Now, this is something which I expect everybody of you to pick up, even if you don't know anything about Doppler. But there is something else in this particular case which I want you to make a note of. Now, when I'm looking at the plaque here, there is something gone wrong with the color flow here as well as here. I think it's clear with all of you. Why? Because there is a mixing of color. Here I have a uniform red, here I have a uniform red, but here in these areas, that is at the level of stenosis or occlusion, and immediately beyond it, I can see there is a lot of mixing of colors. Now, I hope you remember our example of the hose pipe, which I keep on giving all the time. Whenever you need to increase the velocity of flow of water when you're watering your plants, then what you do, you just gently pinch the tip of the pipe, and this increases the velocity. Similar flow dynamics occur on a plaque. Here we are seeing that there is a mixing of color because the blood flow has become very turbulent, and this turbulence is called as aliasing. Now I hope that you would remember everything about atherosclerosis, because this is pretty much everything that atherosclerosis is composed of. Number one, plaque. Number two, calcifications. And number three, flow abnormalities. So just keeping this picture in your mind, now we'll be looking at some of the important theoretical aspects of atherosclerosis, and then be looking at the individual cases. So let's start our discussion with atherosclerotic plaque. Whenever a patient with a suspected carotid vascular disease comes to you and he presents to you with a plaque, you just scan the neck of the patient and you find a plaque. Then what are the important headings under which you should define it, or you should write it in your report? First of all, as far as the plaque is concerned, these are four major descriptors that you should always give. What are they? Classification and morphology, location, description, and ulceration. Right now, I know that these things would be appearing very alienating to you. a bit difficult to you, but as we're going to decipher through the topic, all these things will become very easy. What is classification? You're going to learn about a GW classification. I'll be talking about that. The morphology, that is look of the plaque. It is echogenic, hypoechoic, anechoic, whatever. Then we also going to talk about the location of the plaque. This I'm going to teach you when we look at a plaque, how to define its location, how to define its length. Then the description of the plaque, that is what the extent of plaque is. Some special features like whether there is ulceration occurring or not. Ulceration can occur in a plaque, and this is something which is very difficult to pick. Very difficult to pick. And the best way to pick it is using a color Doppler. On a gray scale, it might be very difficult to pick up ulceration over a plaque, but on color Doppler, we can definitely pick it. Then comes the most important part, that is stenosis. Now, let us, for example, imagine a situation in which you have this carotid circulation, and inside the carotid, you have a plaque here. You describe it very beautifully about the length, about its location, about its morphology, and about its classification. But you don't tell anything about the luminal characteristics, that is, whether the lumen is being occluded or not. Does it make any sense to anybody? Certainly not, because the clinician is interested only in the level of stenosis. If there is a small plaque like this, which is causing no significant stenosis, probably clinician will do nothing about it. If there is a large plaque which is causing significant stenosis, ulceration associated with a lot of clinical deterioration of the patient, probably we need to do an endarterectomy. Probably we'll be needing to do a stenting, as the case may be concerned. So this is very important that we should give the stenosis grading. That is, what is the grade of stenosis? And this is the second most important part, hemodynamic alterations. I've already given you a hint that whenever you see a mixing of colors, that is aliasing, it is an indirect indicator of hemodynamic alterations. But again, we'd have to assess these hemodynamic alterations in form of velocity gradients, which are important for the management of the patient's point of view.